Where are my keys? What did I come in here for? Questions that seem like an everyday thing, but can sometimes mean so much more. Alzheimer's is a disease that affects a person's memory in their everyday life. As a nursing student and the granddaughter of someone who has lost their battle with Alzheimer's, I've done my fair share of research. For this speech, I would like to discuss who is at risk, how this disease progresses, and living with Alzheimer's. There are many risk factors: a person's age, a first-degree relative, a person's sex, and their lifestyle. These are just 4 that I wanted to bring to your attention out of many. The first is age. Age plays a big factor when it comes to Alzheimer's. A person over 65 is at higher risk, but it can also affect people as young as 30 years old. This is usually referred to as early onset Alzheimer's or young onset. The Mayo Clinic says most people with young onset Alzheimer's develop symptoms of the disease when they are between 30 and 60 years old. For some of us, this is 10 years down the road. For others, this could be tomorrow. A first-degree relative is also a risk factor. If your mother, father, brother, sister had it, you are at higher risk to develop it later on. A person's sex. Dr. Maynard Albert states there appears to be little difference in risk between men and women, but overall there are more women with the disease because they generally live longer than men. Lifestyle. Many of the same factors that influence cardiovascular health also play a role in risk factoring with Alzheimer's disease, like stress, smoking, drinking, high blood pressure, and poorly managed diabetes. How does Alzheimer's progress? It first begins as asymptomatic, then it goes to mild cognitive impairment, followed by mild dementia, moderate dementia, and then finally severe dementia. The Mayo Clinic also states the rate of progression for Alzheimer's disease varies widely. On average, a person with Alzheimer's disease lives between 3 and 11 years after the diagnosis, but some survive 20 or more. First becomes asymptomatic. This is where there are no symptoms, but this is the part where the tissue in the brain starts to deteriorate even before the symptoms arise. Next is mild cognitive impairment. This is cognitive slip-ups. It usually lasts about 7 years. It's not noticed by family or friends, but they may blame this on, oh, I'm just getting older. Next is mild dementia. This is more categorized as short-term memory loss, like what did I just do with my keys? Where did I put my cell phone? This usually lasts around 2 years at the most. Personality changes. They become more secluded, a little agitated, because I just lost my keys for the 3rd time in a row. They have difficulty expressing feelings and thoughts, like the expression, it's on the tip of my tongue. They can't quite get out what they're trying to say. They get momentarily turned around or misplace things. They'll, why did I come into this kitchen? Things like that, and it finally registers back. Moderate dementia. This can last up to 2 years. It starts with poor judgment. My grandfather, who suffered from Alzheimer's, my grandmother used to tell me stories about when he was first diagnosed with it, he sold everything for $5,000. It didn't matter if it was worth $50,000, $200,000, it went for $5,000. Greater memory loss is also a symptom of moderate dementia. He wouldn't even remember that he sold it, and he would go looking for it and couldn't find it. They may need help with daily activities. Their brain isn't sending the correct sensors. They may have some muscle reflexes that are deteriorating. Significant personality changes. They can become severely agitated. They're not able to do the things that they're used to be doing, and they get a little aggravated by that. Finally, there's severe dementia. This can last up to 3 years. This is when they lose the ability to communicate and decline in physical abilities. They're no longer able to walk. They're no longer able to swallow. They can't talk. They have trouble even looking straight ahead. Finally, living with Alzheimer's. Living with Alzheimer's can kind of go in 3 stages: emotional changes, physical changes, and family changes. Emotional changes. Usually you go through the 5 stages of grief: denial, anger, bargaining, depression, and acceptance. Emotional changes usually take place within the first 2 phases of Alzheimer's disease. mild cognitive impairment, and moderate dementia. Physical changes. Like I stated earlier, usually with severe dementia, they are unable to walk or swallow, the uncontrollable muscle movements because their muscles and joints are deteriorating. Family changes. The family usually grieves long before the person dies. This is because they know it's inevitable, it is a poor prognosis. Then you come with taking care of the person. Family strengths are tested as the family dynamic changes. The Alzheimer's Association on their support group page said, Alzheimer's gradually takes away the person you know and love. As this happens, you will mourn him or her and may experience different phases of grieving: anger, denial, guilt, sadness, and acceptance. The stages of grief don't happen neatly and in order. You may move in and out of different stages as time goes on. Taking care of your loved one. Some people choose to take care of them personally and keep them at home. Then some may choose to bring in a nurse to stay with them and help because they can't do it on their own. Or they have to put them in a long-term care facility because they are unable to provide them the good care that they deserve. In conclusion, this isn't just a memory disease. This is also physical. And watching my grandfather go through this was a pain that I cannot describe. It is a dim and inevitable prognosis. Your family dynamic changes and shifts, and you have to figure out what's going on without the support of the person who used to be the head of the home. There is no cure, but maybe one day the last tear will be shed and the last memory lost.